Have you ever felt a burning, throbbing sensation in your joints? This could be arthritis, or it can even be gout.
Both of them are joint pain basically, no? So one or more joints are painful, no? But it really differs in terms of how often, when, and how long they've been feeling the joint pain.
It is about time that these young people get to know that they are also at risk for all of these bone, joint, and muscle diseases.
There are ways to manage these diseases, or even better, we can prevent them altogether. I'm Dr. Freddy Gomez. Join me as we learn more about arthritis and gout. Welcome to MedTalk Health Talk. Millions of Filipinos suffer from arthritis every year, causing pain, swelling, and inflammation of their joints. Let's listen to one person's story as they deal with this disorder.
Ako si Vincent Buted. I was diagnosed with arthritis 5 years ago. 2017, na-encounter ko yung pananakit sa paa. Akala ko noong una parang napilay lang ako. Hindi ko siya masyadong pinapansin kasi noong una. Pero dumating yung time na hindi ko na siya mailakad. So hindi ko siya masyadong pinapansin pa rin kasi feeling ko bata pa ako para magkaroon ng arthritis. So until such time, nung sa office, hindi na ako nakapaglakad. Tapos ni-wheelchair nila ako palabas. Tapos dinala na ako sa hospital. Tapos doon pa lang ako nagpa-check up. Doon nila na nalaman na may arthritis ako. 0 to 10, 10 talaga masakit. Hindi mo siya talaga may tatapak na parang gusto mong sumigaw, na gusto mo na lang buhatin ka nila, ayaw mo nang itapak yung paa mo. Ganun siya kasakit. Yung habit namin sa pagkain, kasi Ilocano kasi ako So normally ang mga Ilocano talaga maalat. So sabi nila nung na-diagnose ako, in-explain naman sa akin nung doctor na tumingin sa akin na yun nga, cause ng arthritis is una, tumataas yung uric acid mo. Yung father ko kasi, he passed away dahil sa kidney failure niya. Pakiramdam ko, naman ako siya sa father ko kasi syempre, isa lang kaming sabay-sabay kumakain, kung anong pagkain nila, pagkain din namin. So, yung mga red meat, mga baka, tapos yung mga mabubutong pagkain, yung mabubutong gulay. Call center ako, nag-work. So, yung spare time ko, parang hindi ko siya supposedly dapat nagbo-workout pa rin ako, di ba? Pero hindi ko siya nagagawa kasi parang mas gusto ko na lang matulog. Maraming nagbago sa buhay ko. Unang-una, yung lifestyle ng pagkain. Hindi lahat pwedeng kainin ko. I mean, limitado na, kumbaga. Hindi katulad dati na, kakain ako ng maraming taba. Yun, kasi nagka-cause din kasi yun ng Kapag nararamdaman ko medyo masakit na, yun, kakainom na ako ng gamot pang sa uric acid para maiwasan ko na yung pagsakit ng paa ko. Ngayon, kasi kapag hindi ako masyadong uminom ng pain reliever basta kung kaya ko lang, hanggat kaya ko hindi ako inom kasi may side effect din kasi yung pain reliever. So, ang ginagawa ko more on tubig talaga. Tubig, tapos as much as possible, kailangan ilakad ko pa rin ng ilakad. Tapos, syempre, di mo maiwasan, kahit na bawal sa'yo, kinakain mo pa rin kasi parang hindi mo siya matanggal dahil yung family mo kumakain ng bawal. So, ikaw rin kakain ka na rin, ganun. Hindi ko nagagawa yung mga bagay na kailangan kong gawin, like yung gagawin ko din sa bahay. Tapos yung may online din kasi ako na online business. So, yung mga deliver ko nagkaroon ng napopospone, nadidelay kasi hindi ako makababa, hindi ako makalakad, ganun. Kasi mahirap. Malaki talaga yung factor ng support, ng family support. Kasi syempre, kung hindi ko magagawa yung bagay na dapat kong gawin, andyan sila for me to, mag-cover up ng mga bagay na kailangan kong gawin. Yung matagal na paglalakad. Katulad dito, nagpunta kami ng Hong Kong. Medyo challenges sa akin yun kasi yung mga bata, excited yan So, yung kahit gusto mo silang makasama maglakad ng mahaba, nakaupo ka lang. Kasi ayokong maramdaman yung pain, kaya iniiwasan ko. Simula pa lang kapag medyo kabataan mo na kailangan natin bantayan yung mga kinakain natin. Kasi pag nagkaedad na tayo, nag-30 tayo above, yung metabolism kasi natin medyo bumabagal na eh. Kailangan talaga natin ng regular check-up para mabantayan natin mabuti yung health natin. Yung last check-up ko, yes, sabi ng doktor sa akin is gout na daw siya. Kasi sa mismong pinaka-joint na nagkakaroon ng nung uric doon na siya nag-stuck eh. Itong right foot ko, yan na parang mayroon siyang bukol dyan. Dati wala yan eh. Yan o. So pag sumasakit yan, parang elastic, pulang-pula yan. Tapos masakit. Pero wala naman yun. Ngayon talaga, sobrang mas maingat na ako sa lifestyle ko, sa mga kinakain ko. Kasi may masakit talaga magkaroon ng arthritis.
Learning firsthand from someone how they deal with a certain condition can really help us cope with any challenges that this may give. When we return, we'll learn more about arthritis as well as gout, another common disease here in the Philippines. So keep it here on Med Talk Health Talk. Welcome back to Med Talk Health Talk. We've been learning more about arthritis today, but now let's take a look at another really common condition here in the Philippines, and that is gout. How do these two conditions compare? How are they similar? How are they different? To help us answer those questions and more, we have with us Dr. Gabriel Baluyon, orthopedic surgeon from the Medical City. Now, first let's talk about, in simple terms, ano ba talagang arthritis?
Well, basically, when we say arthritis, it's a general term actually meaning inflammation or pamamaga sa mga joints, no, kasukasuan ng katawan natin. And then there are specific types, like you mentioned, gouty arthritis is one of them. Most commonly though, when Pinoy say arthritis, they're actually referring to degenerative osteoarthritis, and that's the wear and tear type of arthritis that most Filipinos are referring to.
What are some of their similarities? How do they differ?
Yeah, so similarities, both of them are joint pain basically, no? So one or more joints are painful, no? But it really differs in terms of how often, when, and how long they've been feeling the joint pain. No? So in a degenerative osteoarthritis, the typical type of arthritis, it's usually a long process. No? Over time, you begin to feel pain in one or a few of your joints, mostly the weight-bearing joints like the knee or the hip. When it's gouty arthritis, often it's associated with a sudden attack, or we call it a flare, a gouty arthritis flare. And that usually involves the foot, no, most commonly. And that's overnight, from no pain, kinabukasan biglang masakit na masakit. Really now, when we're talking about the food that we want to avoid to prevent gouty attacks, it's usually common street foods among Filipinos. No? So laman loob, no? Liver, kidney, isaw, these types of food are really the notorious triggers for gouty attacks these days, along with alcohol, in particular beer. No? So dati sinasabi ng mga Filipino, mani, beans are the things to avoid, when actually that's not true anymore.
Because a lot of people associate arthritis as a given. Ito'y normal kapag umabot ako ng certain age, automatic, it's normal na may joint pain na ako, probably arthritis. Is this correct thinking? Is this inevitable, kumbaga?
So as early as young adulthood and adulthood, we're really trying to teach our patients to engage in the healthy behaviors and healthy activities that will help prevent the arthritis from happening. No? And when you do get arthritis, if you do, we want it to be a trigger for you to seek consult.
First of all, let's talk about arthritis, then talk about the common symptoms kapag gout.
Yeah, so common symptoms for a degenerative osteoarthritis or the typical arthritis is usually a pain in one or two of your joints, most commonly in the lower extremity. So either yung tuhod, yung hip, or it can also be the hands. No? When we talk about gouty arthritis, in theory, it can actually affect any joint, but most commonly yung paa yung naapektuhan sa gout, in particular the joint in the big toe.
Okay. Now, is there something about yung ugali ng ating ng mga Pilipino that makes gout as well as arthritis very common dito sa Pilipinas, aside from being matiisin?
No? In general, nowadays, we tend to have a more sedentary lifestyle, less exercise, lots of sitting in the computer, in front of the TV, and then the diet is also high in processed foods, no, sugary foods, soft drinks, and then of course, high cholesterol foods, no, fatty foods, mga laman loob, things like that. No? So in general, we're seeing a lot more of these cases because of the way we're living these days versus before. No?
When it comes to arthritis, and gout, ito ba isang condition na mamana?
Well, there is an association of your parents or your family had arthritis or gout. You might be at a higher risk at getting gout or arthritis eventually. But there's also a big environmental factor. No? So the wear and tear, the diet that you have, the lifestyle, also play equally important parts in you possibly getting those diseases.
What can people do in their lifestyle that can improve the current situation, whether they're diagnosed with arthritis or they're diagnosed with gout?
So I would say there would be two cornerstones of lifestyle changes that they can do. Physical activity is actually very important in preventing arthritis. Diet is also very important. We want to avoid the high cholesterol, high fat diet that will predispose you to being overweight. Weight, of course, plays a factor. The heavier you are, the more strain that our joints need to carry.
What are some red flags when it comes to arthritis, when it comes to gout, na dapat na talagang ipatingin ito?
Yeah. So definitely when it comes to osteoarthritis, meaning the wear and tear type of arthritis, the moment you start to feel arthritis on a regular basis, meaning you're feeling it every day, it's triggered by activity, you're unable to walk as far as you used to, definitely you want to see a doctor because there are things that we can do to slow the progress, prevent it from getting worse, and even treat it, stop it from coming back in a more severe form. When it comes to gouty arthritis, the moment you have a severe attack, meaning you wake up one day and your joints are very painful, definitely you want to be seeing a doctor to check if it might be a gouty arthritis attack.
Okay. Is this possible? Are there any risks on trying to manage these two diseases on your own?
Yes, definitely, because like I said, there are lots of types of arthritis and it's hard to say which one you have on your own. You definitely want to see a doctor so they can guide you through it and assess what type of arthritis you might have, because definitely the treatments and the preventions are different depending on what kind of arthritis you might have. So I really discourage patients from trying to treat it on their own. It's really best to see a doctor. It's always good to have the guidance. So I think that's best.
Can medication be enough to mitigate those who do not want to change their lifestyle? I still want to eat, I still want to drink, I'm taking medications for this. What can you advise for those who are thinking that way?
Well, yeah, ideally we don't want them to continue consuming the triggers, especially when we're talking about gouty arthritis. Medication definitely has a role and that will help prevent the attacks and lower the levels of uric acid in our blood. But if we continue to eat the food na pinagbabawal sa atin ng doctors natin, parang magkokontrahan lang sila. So it's really not advisable. No? One is not a magic bullet for you to be allowed to eat those foods. So everything goes hand in hand. No? Exercise, diet, medications, all need to be part of the team, kumbaga, for treatment of these diseases.
Thank you so much for that, Dr. Gabe. Definitely a lot of our viewers learned more now about both arthritis as well as gout. Now, when we return, we'll talk more about joint diseases as well as how to spot them. So keep it here on MedTalk, Health Talk. Welcome back to MedTalk Health Talk. Now, we've been talking about joint-related diseases. Now, let's talk about caring for not just our joints, but also our bones and our muscles as well. Now, to help us with that discussion, we are joined by Dr. Teresa Marie Valdez-Falier. She practices endocrinology and is also the current president of the Osteoporosis Society of the Philippines. Hello and welcome to MedTalk Health Talk, Dr. Ai.
Hello, Doc Freddy. How are you?
I'm doing well. Thank you for being with us on the show. Now, Dr. Ai, our bones, our joints, our muscles, napaka-critical nito sa ating mga katawan. We all know that, pero marami pa ring tao take this for granted. Why is this so kaya?
Well, actually, you were right. The bones, joints, and muscles are really an integral part of our musculoskeletal system, which gives shape and support to our body. So they're really very important. It's really just so sad that people take it for granted, probably because they thought this would really be healthy their whole life. However, we have to take note that these change over time and adapt to our lifestyles. So if we're not doing a healthy lifestyle, probably our joints, muscles, and bones will eventually be unhealthy as well.
That's right. So it's no better way to spread awareness. And it just so happens that we are celebrating World Osteoporosis Month as well as Bone and Joint Awareness Week. Now, how important is it na maging aware ang mga tao about this? Lalong-lalo na yung age group who might think na masyado pa silang bata para isipin nila yung health ng bones and joints and muscles nila.
Yes. Actually, as you've said, October is the Bone Awareness Month. And it's really sad nowadays. We see a lot of very young people having diseases of the frail and elderly, no? So, it is about time that these young people get to know that they are also at risk for all of these bone, joint, and muscle diseases. So, they should be living a healthy life as early as now.
Okay, so napaka-importante yun. Now, pag-usapan natin what will happen kapag hindi nila inalagaan yung bones, joints, and muscles nila at an earlier age. Let's talk about some of the consequences. One of the more common ones is osteoporosis.
Yes, osteoporosis is when the bones are weakened. It's like they become mamon. But the thing is, osteoporosis is a silent illness. We never get to know about it until there is a fracture. And nowadays, we see a lot of young people having fractures, no? And it's just because they're having unhealthy bones, joints, and muscles. So it's really very good that we're having all of these awareness things, so people will now take good care of their bones. And also, we also have, especially people from the BPO community, they also have a lot of myalgias. No, these are when the muscles get to be inflamed and swollen, and then they cannot work anymore. So they become unproductive. And of course, the quality of life, it goes down. So it's really good that we're having all of this right now, and we're discussing all the diseases that are correlated with it.
Yes, it is very important, Dr. Ai. And of course, ang importante dun is what people can do. Ano bang pwede nilang gawin? Because a lot of Filipinos nagpapatingin sa doktor kapag may sakit na. But what they don't understand is prevention is always better than cure. And one of that is lifestyle change. So pag-usapan natin yun, what type of changes sa lifestyle ng isang Filipino ang maganda para to prevent these bone, joints, and muscle diseases?
Well, yes, correct. Lifestyle change is really very important. So we start off usually with a healthy diet. So that would mean that we're going to eat a balanced diet with all the proper nutrition with it. And then, of course, regular exercise. And then avoiding all of these vices like smoking and moderate intake of alcohol and caffeinated drinks. So I think these all of them together would make a very big impact in our health.
Okay, so avoiding smoking and drinking, limit caffeinated drinks. Pag-usapan natin yung diet because yan ang very integral sa mga Filipinos. Let's talk specifics. Ano ba talaga sa diet ang maganda in order to have our bones, joints, and muscles healthy?
Well, aside from having a balanced diet, important for us would also be your calcium, your vitamin D, of course, your protein intake, and all of these necessary multivitamins that would affect our metabolism. So if we take a balanced diet, and if we're not able to take that, then we can supplement this with milk and all of these healthy foods and drinks, then we are liable to have a good lifestyle.
Okay.
Yes.
How soon do you think, Dr. Ai, should people adopt this lifestyle?
Oh yes. So since we were kids, we were told to drink milk, no?
Mm-hmm.
But nowadays, the adults, they stop drinking milk, thinking this is a kid stuff, no? But actually, kids is for all ages, no? So it's not just for the very young and for the very old. So even the young adults and even the middle-aged adults, they should be drinking milk. And this is good for the bones, the joints, and the muscles as well.
We learned a lot from you today, Doctora, especially when it comes to what we should do, especially lifestyle changes. Do you have any advice for our viewers, especially when it comes to caring for one's bones, joints, and muscles?
Remember, your bones, joints, and muscles, they would aid us for our activities of daily living. So it would be best if you start off with a healthy lifestyle, eating well, supplementing your nutrition with your calcium, vitamin D, proteins. So all of that in your milk. Milk is for all ages. It's not just for the young and the elderly, but for our age as well.
Thank you so much, Dr. Ai. Managing bone, joint, and muscle-related diseases can be challenging, but there are ways to cope as well as treat them. It's never too late to adopt healthy habits. This is Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.
This program is brought to you by